You know, sometimes the biggest medical mysteries are the ones that are literally gone in a heartbeat. Today, we're going to play detective. We're diving into the world of the heart's hidden rhythms, those sneaky, irregular heartbeats, and the incredible tools doctors use to catch them red-handed.
And listen, the stakes here are incredibly high. Just get your head around this number. A full 50% of deaths from heart disease come from something called sudden cardiac death. And here's the really scary part. For half of those people, it is the very first sign that anything was wrong. It's a massive, silent threat.
So what is this silent threat we're talking about? Well, it's caused by arrhythmias, which is really just the medical way of saying an irregular heart rhythm. And these aren't just little flutters you can ignore. If they go undetected, they can have serious, even life-altering consequences.
I mean, the potential fallout here is huge, and it's wide-ranging. We're talking about everything from fainting spells that can cause pretty nasty injuries, all the way to way more severe outcomes, like sudden heart failure, damage to your organs, or something called thromboembolic disease. That's just a fancy term for when a blood clot breaks loose, travels through your body, and causes something catastrophic, like a stroke.
So this brings us to a huge problem for doctors, a real dilemma. I mean, if these things are so dangerous, why don't we just find them and fix them? The problem is, they're sneaky. They don't just happen on command when you're in the doctor's office. They can be incredibly fleeting, happening for maybe a few seconds, and then poof, they're gone.
So that's the million-dollar question, isn't it? How in the world do you find a problem that is actively hiding from you? It basically turns diagnosis into a form of medical detective work. You can't just look for clues after the fact. You have to set up surveillance and wait for the culprit to finally show its face.
And this really shows you the limits of our most common heart test. A standard ECG, you know, the one you get in a clinic, it's like taking a single photo of your heart's electrical activity. If the arrhythmia isn't happening in that one single moment the picture is taken, you've completely missed it. What you really need is the whole movie, and that is exactly what ambulatory monitors are for.
So to solve this very problem, medicine has developed an entire toolkit of these ambulatory monitors. These are incredible devices designed to watch the heart continuously while you're just living your life, for days, for weeks, and in some cases, for years at a time. And there's a whole family of these things, right? From patches you wear on your skin to recorders you carry, and even tiny ones that can be implanted for really long-term surveillance. But to get the main idea, let's focus on two of the most common detectives on the case, the Holter monitor and the loop recorder. Okay, so let's put these two head-to-head, because their approaches are different. The Holter monitor, think of it like a super detailed diary. You wear it for about 24 to 48 hours, and it records every single heartbeat, non-stop. It's perfect for catching problems that happen pretty often. But the loop recorder, that's for the really elusive suspects. You can wear it for weeks, and it records in a loop, constantly overriding old data until you feel a symptom and press a button. Or the device detects one itself. Then it saves that crucial piece of evidence. But here's the thing. Catching the arrhythmia is really just step one. The real magic, the life-saving part, is what doctors can do with that information. It's all about taking that data and using it to go from just detecting a problem to actively preventing a disaster down the road. And one of the biggest, most common bad guys these cardiac detectives uncover is something called atrial fibrillation, or AFib for short. This is where the heart's top chambers just start beating chaotically, which can let blood pool up and form dangerous clots. And get this, for some people, the very first sign they have AFib is when they have a massive stroke. Finding it before that happens is the whole ballgame.
So once they've found AFib, how do doctors turn that into a plan? They use a specialized tool, like this one, the CHADS-2 VAS score. Now, you don't need to memorize this chart. Just think of it as a risk calculator. Doctors plug in a patient's different health factors, their age, blood pressure, things like that, and it spits out a score that tells them that person's specific risk of having a stroke.
So the path forward becomes crystal clear. Step one, the ambulatory monitor, our detective, catches the bad guy, the arrhythmia. Step two, the doctor, now the analyst, uses a tool like that risk score to figure out exactly how dangerous the situation is. And then, step three, a treatment plan starts, usually with medication to stop those dangerous clots from ever forming. Of course, it's a very careful balancing act. The very same medicines that are great at preventing clots also increase the risk of bleeding. So doctors use another scoring system, this one called the has-bled score, to weigh the pros and cons. It's all about making sure the treatment plan is as safe and effective as it can possibly be for each individual person.
So let's bring this all home. Why does this kind of detective work, this detailed monitoring, matter so much? Well, it all comes down to the incredible power of getting an early, and maybe more importantly, an accurate diagnosis for a problem that is literally designed to hide from you.
So if you remember anything from this, let it be these 4 things. First, arrhythmias can be silent, but they can also be deadly. Second, they are incredibly hard to catch precisely because they come and go. Third, our cardiac detectives, monitors like the Holter and the loop recorder, are the right tools for the job. And finally, that data they gather is what gives doctors the power to look into the future, assess risk, and prevent a disaster like a stroke from ever happening.
When you really think about it, what these technologies let us do is, well, it's profound. It's not just about monitoring a squiggly line on a screen. It's about getting a glimpse of a possible future, one that might have a stroke in it, and getting the chance to rewrite that future entirely. That's not just treatment, that's prevention at its most powerful.